If you ask an 80-year-old woman what she had for lunch yesterday, she probably wouldn't be able to recall. But if you ask her about how her birth went, she'd be able to tell you vivid details of everything that occurred. Women remember their births. It's a significant life event. So if we can make a positive impact by advocating for continuous labor support, as nurses, we should make every effort to do so. Studies show that women with continuous support during labor were less likely to have regional anesthesia, a cesarean surgery, or to report dissatisfaction with their childbirth experience. Today, I'm going to discuss, first off, how labor support can reduce the likelihood of an epidural. Then I'm going to describe how continuous support decreases the chance of operative delivery. Lastly, I'm going to share how labor support benefits a woman's perception of her childbirth experience. First, I'd like to talk to you about pain relief in labor. Women who have continuous labor support are less likely to have an epidural. According to Adams and Benici in a 2008 study, labor support person or doula promotes ambulation and proper positioning, which can reduce pain and speed the labor process. The uninterrupted comfort, praise, and reassurance that is provided reduces the need for pain medicine, according to a study by McGrath and Kennel in 2008. Now that I've discussed the reduction in regional anesthesia, let's move on to my second point about decreasing the need for a cesarean section. Labor dystocia is the most common reason for a cesarean section, according to a report by Thornton in 1994. As I mentioned before, doulas can help speed the process, therefore negating labor dystocia. According to Hodnett in 2013 study, continuous support is a behavioral intervention that significantly reduces the need for cesarean delivery. A support person advocates for a patient's decisions in labor by being supportive of the decisions can reduce the stress response. A stress response is the release of catecholamines, which are stress hormones. The body does not release oxytocin, which causes uterine contractions, sufficiently if it is releasing stress hormones. This in turn can increase the length of labor. As you can see by the chart here, the continuous presence of a supportive companion during labor and delivery in 2 studies in Guatemala and 1 study in Houston shortened labor and reduced the need for cesarean section and other inventions, according to Kennel in 1991. So as you can see here, the length of labor in the first Guatemalan study went from 19 hours to 9 hours with the doula, and the second Guatemalan study was 15.5 hours, and it went to 7.7 hours by having doula support. The Houston study was 9.4 hours with no labor support, and it was reduced to 7.4 hours. We can also look at the C-sections. If you look at the second Guatemalan study, 17% to 7% reduction. And the Houston study, 18% to 8% reduction. And also noted, very important, the epidural anesthesia. Houston study, 55% with no doula, and it went to 8% with the doula. That is a significant reduction. Lastly, but not leastly, I would like to talk to you about satisfaction in giving birth. In a study reviewed by 2013 by Hodnett, it shows the quality of emotional care received during labor and delivery can strengthen or weaken the emotional ties between mother and baby. Women who were supported reported increased breastfeeding success and decreased postpartum depression. As you see from these 3 main points, women with continuous support during labor were less likely to have an epidural, a cesarean section, or to report dissatisfaction with their childbirth experience. To summarize, first I showed you the reduction in pain and a need for an epidural. Then I talked about decreasing labor dystocia along with decreasing the cesarean delivery. And lastly, I shared with you the benefits to mother and baby to having a satisfying childbirth experience. Labor support is a safe option to improve birth outcomes. As nurses, you can make a difference. Advocating for continuous labor support has clinically meaningful benefits for your patients. Every woman should have access to these benefits. Thank you.